HGH deficiency symptoms. What causes HGH deficiency? Human development involving skeletal and muscular growth is acted on and affected by human growth hormone, HGH, which is a natural polypeptide hormone. However, there are instances where the pituitary gland fails to produce enough human growth hormone. Human growth and development stalls due to the lack of HGH, which is the driver of mental and physical development. Some people experience HGH deficiency early in life and need human growth hormone in order to help them grow and reach their normal final adult height. Other people experience human growth hormone deficiency later in life, either as a result of illness or trauma, or even as a natural result of the aging process. For patients with clinically low levels of human growth hormone, injectable HGH therapy or sermorelin acetate therapy can help improve health and wellness and mitigate the health decline associated with hormone deficiency. Lack of HGH is primarily a pituitary gland problem. The hypothalamus is easily affected by external and internal conditions of the body. Surgery and radioactive elements of any medical operation and treatment may leave the hypothalamus damaged. In the same manner, a tumor or any unnecessary growth of tissues in the pituitary gland area may cause a disruption to HGH production. HGH deficiency is not just a childhood problem. The condition may seriously impact the mental and physical development of an adult, especially later in life. A person suffering from HGH deficiency accumulates higher levels of fat in the lower and middle body. The body can become deformed with the worsening underdevelopment and reduced bone density. Although human growth hormone deficiency is the result of an underactive pituitary gland, this issue is often the result of changes in hormone balance caused by the control center of the brain, known as the hypothalamus. Cardiovascular diseases are very common among sufferers of HGH deficiency. They tend to have higher cholesterol buildup than people with normal levels of HGH. The triglyceride level of the body is higher than normal, which causes blood vessels to become clogged, removing the proper blood circulation and body oxygenation. In severe cases, this clogging of the arteries can lead to heart attacks and strokes. Of course, sufferers of HGH deficiency do not exhibit strength and endurance compared to people with normal levels of HGH. Lack of strength and endurance is one of the more profound symptoms often used to diagnose HGH deficiency. Emotionally and psychologically, HGH deficiency can result in depression and anxiety. The emotional stability of a person can be affected dramatically. These and other symptoms of HGH deficiency can help you understand the situation and identify your diagnosis. If you suffer from any of these symptoms, we recommend you contact one of our physicians for a simple blood test that will measure your levels of HGH and allow the doctor to prescribe you the right dosage of human growth hormone to correct the imbalance. The following are some of the prominent symptoms of human growth hormone deficiency. Loss of muscle mass, unexplained weight gain, depression, loss of bone mineral density, general cognitive decline, fatigue, diminishing exercise capacity, trouble healing, weakened immune system. These are just a small number of the symptoms associated with human growth hormone deficiency. To get started with your own co-created HGH, testosterone, sermorelin, or HCG therapy program, please consider clicking the link below in the description. With our help, we can restore hormone balance and help you live a happier, more vibrant life. Thank you for watching.